first thing what you have to do is greet. Okay, so as I told you yesterday, you will be sitting outside the station and there'll be a station descriptor kept on the wall. You're reading the station descriptor, and when the examiner calls you into the room, you're going into the room, and there you say, okay, I'm ready for the exam, and then the exam starts. So the patient will be there, maybe sitting or lying down. So when you get into the room there, first thing you greet the patient. You say good morning or good afternoon or whatsoever. Along with that, please do not forget to do hand rub. I haven't written it here, but that is there for every station except for seizures and CPR. When you're going to provide care for seizure patient or when you're going to provide a CPR, you do not do a hand rub because that is emergency. But in all other cases, whether it is communication or education or whatsoever, you have to do a hand rub because we don't know at what time we are going to touch the patient. Okay, if the patient is going to be very anxious or if the patient is going to cry in front of us, you might just tap the patient, you know. So even for that, you have to do a hand rub. So always keep in mind, with greeting, hand rub, that comes together. Okay, so you go into the station, just press on to the hand pump there, and while hand rubbing, you can say good morning or good afternoon or good evening and address the name of the patient, because the name of the patient will be given in the station descriptor. So say good morning Mrs. Bryan or good afternoon Mr. Brown or whatsoever. So that hand rubbing and greeting will go together. Never forget that. Okay, next thing is you'll introduce yourself. So you'll say good morning, my name is so and so, I'm the nurse who's going to so in this situation what you're going to do is, it's your student who's in front of you, so it's not your patient. So here what you say is good morning, so the student's name or whatever, I'm the nurse in charge here, so I'll be assigning you a patient who has undergone lumbar surgery and you will have to take care of her. So what is your good name, please? So you are asking the student hers or his name and you are introducing yourself here. Okay, did you get till that point? So the next thing is you are going to check what is the previous knowledge of the student. So you have it mentioned while you are introducing that you're going to say about the care after lumbar surgery. So you will ask the student there, okay, have you ever heard of a lumbar surgery? Or in your second year medical surgical classes, did you ever hear about a lumbar surgery procedure or what the care has to be given to such patients? Have you ever had any experience regarding lumbar surgery in your education? So the examiner who's going to be with you will say that they know nothing about it. Okay, keep in mind. They'll say they have never heard about a lumbar surgery and they don't know anything about lumbar surgery. So that means you will have to explain it. So prevention of chest infection. So first you will have to tell is the development of chest infection. How is it developing after the lumbar surgery? That the patient is lying down mostly on the prone position, so they are not moving much because after the surgery they cannot, and so there's pooling of secretions and they cannot clear their chest, so hence it can lead to chest infection. So very briefly, we are not telling the whole pathophysiology but the main cause, root cause of chest infection, and we are then just jotting down regarding how you prevent chest infection. So the first thing is deep breathing, coughing, incendiary spirometer. That's the main 3 points which you will have to deal with.
For touching a patient, you have to wash your hand hygiene. You have to perform hand hygiene. I'm not saying about hand washing, hand hygiene I'm saying, because there is hand washing and hand rub. So sometimes in some under some circumstances we are not performing hand washing. So here in Ireland, in the nursing home or in the hospital, so we don't do hand washing frequently. What we are doing, like we do use hand rub, but the steps are same. We have to use the hand rub properly. So here I'm saying about hand hygiene, not hand washing. So it's like before touching patient, before clean aseptic procedure, before any aseptic procedure, we have to perform hand hygiene, and after body fluid exposure risk. Body fluids like blood, urine, vomitus or anything. any secretion, saliva or anything like that. Then after touching patient surroundings. So there is an order for that. Could you please explain how the hand washing should be performed? What's the timing? First of all, time.
Actually, it's nearly take 1 minute for the hand washing technique, and as per WHO, there are 7 steps to be followed. And firstly, we have to take the hand rub, and we have to do the first we want to do the rub the hands together, the palms together. Then we have to rub the back side of this hand of this
with purple lid, yellow rigid bin with black lid, and this is the non-wrist based black or clear bags. Sometimes there will be white bags, sometimes there will be black bags provided.